Top 25 Laboratory Technician Interview Questions and Answers. Laboratory technicians play a critical role in healthcare, research, and scientific testing by ensuring accurate results and maintaining laboratory standards. Employers seek candidates with strong technical knowledge, attention to detail, safety awareness, and teamwork skills. Preparing for a laboratory technician interview helps you confidently demonstrate your competence and professionalism. The following top 25 laboratory technician interview questions and answers are designed to help you understand what interviewers expect and how to respond effectively. 1. Can you describe the role of a laboratory technician? A laboratory technician is responsible for collecting, preparing, and analyzing samples to support diagnostic, research, or quality control processes. Duties include operating laboratory equipment, recording results accurately, maintaining clean workspaces, and following safety protocols. Lab technicians also assist scientists or physicians by ensuring reliable data is available for decision-making. Attention to detail, organization, and adherence to procedures are essential. The role supports accurate diagnoses, scientific advancements, and compliance with industry standards across healthcare and research environments. 2. Why did you choose a career as a laboratory technician? I chose this career because I enjoy working in a scientific environment where accuracy and responsibility matter. Laboratory work allows me to contribute directly to patient care, research, and innovation. I find satisfaction in following precise procedures and producing reliable results. The role matches my strengths in organization, analytical thinking, and attention to detail. Being part of a laboratory team gives me a sense of purpose, knowing my work supports important medical or scientific decisions. 3. What laboratory equipment are you familiar with? I am familiar with microscopes, centrifuges, spectrophotometers, autoclaves, pipettes, and hematology analyzers. I have experience calibrating equipment, performing routine maintenance, and troubleshooting minor issues. I understand the importance of using equipment correctly to avoid errors and ensure accurate results. I also follow manufacturer instructions and laboratory protocols strictly. Familiarity with laboratory information systems, LIS, further helps me document and track samples efficiently and accurately. 4. How do you ensure accuracy in your work? I ensure accuracy by following standard operating procedures, double-checking measurements, and labeling samples correctly. I remain focused, minimize distractions, and verify results before reporting them. Proper documentation and use of calibrated equipment also help prevent errors. If results appear unusual, I repeat tests or consult a supervisor. Accuracy is critical in laboratory work, as even small mistakes can impact diagnoses or research outcomes, so I treat every task with care and responsibility. 5. How do you handle laboratory safety? Laboratory safety is a top priority. I always wear appropriate personal protective equipment, follow chemical handling guidelines, and properly dispose of biological and hazardous waste. I ensure workspaces remain clean and organized to prevent accidents. I'm familiar with emergency procedures, including spill response and fire safety. By strictly following safety protocols and encouraging others to do the same, I help maintain a safe environment for colleagues and ensure compliance with regulatory standards. 6. What steps do you take when handling biological samples? When handling biological samples, I follow strict safety and hygiene protocols. I label samples accurately, store them at appropriate temperatures, and avoid cross-contamination. I use gloves, lab coats, and biosafety cabinets when required. All samples are processed according to laboratory guidelines, and waste is disposed of properly. I understand the importance of maintaining sample integrity and confidentiality, ensuring accurate results while protecting both personnel and patients. 7. How do you handle repetitive tasks in a laboratory? I stay focused by maintaining a consistent routine and reminding myself of the importance of each task. Repetition allows me to improve efficiency and accuracy over time. I take pride in consistency and follow protocols precisely. I also take short mental breaks when allowed to avoid fatigue. Understanding that repetitive tasks contribute to reliable results helps me stay motivated and attentive throughout my shift. 8. How do you deal with pressure or urgent test requests? I remain calm and organized under pressure by prioritizing tasks and following established procedures. Urgent requests are handled efficiently without compromising accuracy. I communicate clearly with supervisors or team members to ensure expectations are understood. Stressful situations are common in laboratories, especially in healthcare settings, so staying focused and composed helps ensure timely and reliable results. I believe accuracy should never be sacrificed for speed. 9. Describe a time you made a mistake and how you handled it. Once, I noticed an inconsistency in test results caused by improper sample labeling. I immediately reported the issue, corrected the labels, and repeated the tests. I documented the incident and reviewed procedures to prevent recurrence. This experience reinforced the importance of vigilance and accountability. Mistakes can happen, but addressing them promptly and transparently ensures trust, maintains quality, and improves overall laboratory practices. 10. How do you maintain laboratory records and documentation? I maintain records by accurately entering data into laboratory systems and ensuring documentation is complete and legible. I follow confidentiality policies and store records securely. Proper documentation ensures traceability, quality control, and compliance with regulations. I regularly review records for accuracy and update them as required. Good record keeping supports reliable results and allows audits or reviews to be conducted efficiently. 11. What quality control measures are you familiar with? I am familiar with internal and external quality control procedures, including running control samples, calibrating equipment, and documenting results. I understand how to identify deviations and take corrective action when control values fall outside acceptable ranges. Quality control ensures test accuracy and reliability. Following QC protocols helps maintain laboratory credibility and compliance with accreditation standards. 12. How do you handle confidential patient information? I handle confidential information by strictly following privacy policies and regulations, such as HIPAA. I never discuss patient data outside authorized settings and ensure records are accessed only for work-related purposes. I store information securely and log out of systems when not in use. Maintaining confidentiality builds trust and protects patient rights, which is a fundamental responsibility of a laboratory technician. 13. How do you prioritize your workload? I prioritize tasks based on urgency, test requirements, and deadlines. Stat or emergency tests are handled first, followed by routine work. I organize my schedule, prepare materials in advance, and communicate with supervisors if workloads become heavy. Effective prioritization ensures smooth workflow and timely results without compromising accuracy or safety. 14. What experience do you have with laboratory information systems, LIS? I have experience using LIS for sample tracking, result entry, and report generation. LIS improves efficiency and reduces manual errors. I ensure data is entered accurately and promptly. Familiarity with LIS helps streamline workflow and ensures results are accessible to authorized personnel quickly. I'm comfortable learning new systems and adapting to technological advancements in laboratory operations. 15. How do you ensure proper calibration of equipment? I follow scheduled calibration procedures using standard reference materials and document results thoroughly. Equipment is checked regularly to ensure accuracy and reliability. If calibration issues arise, I report them immediately and stop using the equipment until resolved. Proper calibration is essential to ensure valid results and compliance with laboratory standards. 16. How do you work as part of a laboratory team? Teamwork is essential in a laboratory setting. I communicate clearly, respect colleagues' roles, and assist when needed. Sharing information helps prevent errors and improves efficiency. I value collaboration and believe teamwork ensures consistent results and a positive work environment. Supporting colleagues ultimately benefits the entire laboratory and the quality of work produced. 17. How do you stay updated with laboratory practices? I stay updated by attending training sessions, reading professional journals, and following updated guidelines. I also learn from experienced colleagues and participate in continuing education programs. Staying current ensures compliance with evolving standards and improves technical skills. Continuous learning is essential for delivering accurate and high-quality laboratory services. 18. What steps do you take to prevent contamination? I prevent contamination by using sterile equipment, following aseptic techniques, and maintaining a clean workspace. I change gloves frequently and disinfect surfaces regularly. Samples are handled carefully to avoid cross-contact. Preventing contamination ensures test accuracy and protects both staff and patients from potential risks. 19. How do you manage time during busy shifts? I manage time by planning tasks, preparing materials ahead of time, and staying organized. I focus on efficiency without rushing. Clear communication and prioritization help manage high workloads. Effective time management ensures deadlines are met while maintaining accuracy and safety standards. 20. What do you do if test results seem unusual? If results seem unusual, I repeat the test and check equipment calibration. I review sample handling and consult a supervisor if needed. Reporting unexpected results ensures accuracy and prevents incorrect reporting. Investigating anomalies is essential for maintaining laboratory integrity and patient safety. 21. How do you handle hazardous chemicals? I handle hazardous chemicals by following safety data sheets, SDS, wearing protective gear, and using proper storage and disposal methods. I ensure correct labeling and avoid mixing incompatible substances. Safety training and compliance reduce risks and protect laboratory personnel. 22. What is your experience with sample preparation? I have experience preparing samples through centrifugation, staining, dilution, and labeling. Proper preparation ensures reliable test outcomes. I follow protocols carefully and document each step. Attention to detail during preparation minimizes errors and improves result accuracy. 23. How do you handle constructive feedback? I welcome constructive feedback as an opportunity to improve. I listen carefully, apply suggestions, and ask questions if clarification is needed. Feedback helps refine skills and ensures high-quality performance. I believe continuous improvement is essential in laboratory work. 24. What motivates you as a laboratory technician? I'm motivated by contributing to accurate diagnoses and scientific progress. Knowing my work impacts patient care or research outcomes inspires me to maintain high standards. Precision, responsibility, and teamwork drive my commitment to excellence in laboratory work. 25. Where do you see yourself in 5 years? In 5 years, I see myself advancing within the laboratory field, possibly specializing or taking on supervisory responsibilities. I aim to continue learning and contributing to quality improvement initiatives. My goal is to grow professionally while maintaining excellence and reliability in laboratory services. Laboratory technician interviews focus on technical expertise, accuracy, safety awareness, and teamwork. Preparing thoughtful responses to common questions helps demonstrate your competence and professionalism. By highlighting your attention to detail, commitment to quality, and ability to work under pressure, you can stand out as a strong candidate. With preparation and confidence, you can successfully secure a laboratory technician role and build a rewarding career in the scientific field.